Good morning, afternoon. Now it is noon on December the 2nd. Welcome to everybody to the 2025 business meeting. I will turn it over to our president, Danielle Fastring.
Thank you, Lydia. Good afternoon, everyone. I am Danielle Fastring. I'm the current MPHA president, and I want to welcome you to our 2025 Mississippi Public Health Association annual business meeting. Thank you all for joining us today during your lunch. Please feel free to eat lunch while you're on the call. We realize this is a lunchtime session, and so please just be comfortable. And as you take your lunch break, please feel free to do that. Today, we are going to hear reports from several different entities within the organization, and we're also going to have a presentation of the candidates for office for president-elect and our secretary position that's open. And so let's see, we are going to get started with a treasurer's report. But before we do that, are there any last minute agenda items or announcements that we need to consider before we get started? I don't think so. All right, well, we will just move directly into the treasurer's report from Paige Stevens, our MPHA treasurer.
Hi, everyone. I'm Paige. On the screen, it says Deanna. I know that's confusing. I'm sorry. I go by Paige. So my report is very short and sweet. Basically, it's our 2024. So we're going to do the previous calendar year because we haven't finished this calendar year yet, so the numbers wouldn't be accurate. So our 2024 revenue was $305,078. Our total expenses were $333,473, which incurred a loss of $28,395. So currently, as of yesterday, our cash available balance is $247,767.54. So do we have, I guess I will make a motion to accept this treasurer's report.
Excellent.
Do we have a second? Dr. Bateman will second. Thank you, Dr. Bateman. Any discussion? Those in favor of accepting the treasurer's report into the record, please say aye.
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 Any opposed?
Aye.
Okay, thank you. The motion passes and we'll accept the treasurer's report into the official record. Thank you. Thank you, Paige. And then next we will have Susan Richmond, who's going to discuss or present the candidates for offices. So I will turn it over to her.
Good afternoon, everybody. I'm Susan Regan. I'm chair of the nomination committee. Today, you'll hear from each of the candidates for president-elect and secretary through a live speech or a pre-recorded video. Each of the candidates will be allowed to address the membership no more than 3 minutes. Full candidate statements will be provided with the voting link. The candidates will go in alphabetical order by the last name and by position. For the position of president-elect, we will have begin with Jamisha Ballard. Jamisha, you have 3 minutes to speak and your time starts now.
Thank you, Susan.
You're welcome.
Good afternoon, MPHA colleagues, partners, and friends. I am Dr. Jamisha Ballard, and I am honored to be a candidate for president-elect for Mississippi Public Health Association. I have dedicated my career to strengthening the health of Mississippi's families, from supporting our youngest children through the WIC program to leading community-centered initiatives that bring policy, innovation, and equity together in real time. But none of that work happens alone. It happens because of partnerships, because of people like you, and because of organizations like MPHA that understand the power of a united public health voice. We are living in a moment where public health must be bold, visible, and deeply connected to community needs. If elected, my commitment is simple. First, to strengthen our membership by making MPHA a home for every public health professional, from seasoned experts to emerging leaders and students who represent the future of this field. Second, to elevate our advocacy efforts so that the issues we champion, from maternal health, food security, workforce development, rural health, and prevention, these issues are not only heard, but they truly shape the policy and funding decisions across our state. And third, to lead with collaboration, transparency, and action. I believe in convening people, in bridging gaps, and in moving ideas from discussion to implementation. I am running because MPHA deserves leadership that is visionary, steady, and grounded in the lived realities of Mississippi communities. Leadership that listens, leadership that works, leadership that ensures MPHA continues to grow, evolve, and lead our state toward better health outcomes for all people. I would be honored to serve you, to work alongside you, and to continue building a stronger, healthier Mississippi together. Thank you for your support and for the work that you do every single day, and I will be honored to have your vote. Thank you.
Susan may be frozen. Our next candidate that we'll hear from is Keltra Chandler. She is also running for president-elect. So, Keltra, you have the floor and you have 3 minutes.
Good afternoon, everyone. I was about to say good morning, but good afternoon. I am Keltra Chandler, and I'm honored to be running for president-elect for Mississippi Public Health Association. First, I'm running because I deeply believe in community engagement and the power of people. Public health professionals, community leaders, the residents that live in the community, we all work together to build Mississippi into what it is today. Excuse me. Throughout my career, as a public health professional, I do a lot of public speaking and a lot of community engagement, whether that's working in rural counties, supporting community-based organizations, or helping even build just public health programs from the ground up. One thing has stayed really consistent with me. Mississippi has everything that we need. We just have to listen to the people around us and be willing to work together. So MPHA has been a home for me professionally. I have been involved in MPHA since I graduated with my master's in public health. I have been in several leadership positions within my sections. It has been a place that I've learned to grow and connect with other people. So running for president-elect is my way of giving back to this community that has poured into me and to help me push forward other individuals with intention, inclusivity, and a focus on the future. So my vision for MPHA is pretty much 3 priorities. I want to strengthen the membership engagement and the value. I want the members of MPHA to feel value of being a part of this great organization. If that means training, networking opportunities, mentorship, all those things, I want them to be able to see that up front and know that these things are offered to them and that they can feel connected, whether they live in the Delta, the coast, the Northeast, or in the dead middle of the state. I want everyone to feel connected. My second point is elevating rural and underserved communities. Much of my professional work is in the Delta, is in the rural part of a rural state. So I do want to elevate and give opportunity to individuals that can be underserved and overlooked and champion for policies and approaches that also include those individuals as well. And my other priority is building stronger partnerships across all the sectors. Public health does not just live in one space. We connect with other sectors such as education, community development, food systems, healthcare, civic organization, just everything. It can overlap with public health. So I would like to see MPH to be the leader in bringing all of these things together to work together to create a healthier Mississippi that strengthens programs, amplifies our advocacy, and moves the needle on the health outcomes that's in our state at this time. So I am running because I believe in Mississippi. I believe in the power of public health. I believe in the power of community engagement. And I also believe in the power of teamwork. I believe that NPHA can continue to grow into what we lead with, which is purpose, collaboration, and heart. It will be an honor to serve as your president-elect, and I would like to thank each and every one of you for your support, your trust, and the incredible work you do every day to make our communities healthier and stronger. So thank you so much. That's all.
I'm on mute. Thank you, Keltra. I appreciate that. And I've put the candidate statements in the chat. So if anybody would like to click on that, I see Susan's back. So let's see if we can
I'm
hear
so
her.
sorry. My computer just absolutely died. It just went blank.
I understand technology.
Yes, you've got to love technology. What were y'all doing now?
Keltra just wrapped up hers,
Okay.
and we're about to move over to Haley and the secretary.
Okay. All right. Let's see. The position of secretary, and we'll begin with Haley. You have 3 minutes. Your time starts now.
Hello, everyone, and thank you for having me here to speak with you. My name is Haley Swigert, and I'm a candidate for the secretary position. A little bit about me. I started off with a Bachelor of Social Work from the University of Mississippi, graduated in 2024. I spent a year in community mental health at a clinic in New Albany, Mississippi. I served clients in the Union, Pontotoc, and Tippah counties. Currently, I am an MSW student here at the University of Mississippi in the accelerated program. I'm also a graduate research assistant for a DOJ-funded project called Stop School Violence. The goal is to improve student support and safety in the school setting. Very excited. We are mainly in Central to South Mississippi. And why am I running? I'm passionate about elevating community voices and building strong partnerships. I believe in strong networks, creating strong public health outcomes, and I want to support that growth. I value partnership and collaboration, and I was impressed with the association's use of different professions like nursing, social work, public health, nutrition, and many more. While I'm in office, I want to help strengthen the structure that keeps members informed, engaged, and connected. I want to create accessible documentation and record keeping and improve communication flow across the association. I believe Mississippi is a diverse and resilient state, and this organization seems to mirror that perspective. So this would be a great opportunity, and I'm looking forward to collaborating and contributing. Thank you.
Thank you very much, Haley, for your statement. Next, we're going to hear from Aura Williams. She was unable to join us, but she will address us with a video statement.
Oh dear. It was working. Okay, here we go. Let me start it over. I'm sorry.
I don't hear anything.
I can't hear.
I can't hear it.
Oh dear. It worked. I did practice, y'all. Let me try a different method of sharing.
You might also have to share your sound. I don't know if it's Zoom or it's Teams. It's one of these platforms. You have when it's something with sound, you have to share your sound too. But I don't
Okay.
know how. So, but
I thought
that
the
might be
method
an
I
issue.
practiced with it earlier and I thought that it would work. Share sound. Let's try this again.
Hello, my name is Ora Williams, and I am currently running for the position of Secretary for the Mississippi Public Health Association. So, just a little bit of background about me. I'm a recent graduate of the University of Southern Mississippi, where I earned my Bachelor's of Science in Public Health. And while I was there, I was able to serve as the Vice President of the Student Public Health Society. And I also interned with the Mississippi Inbred Telenutrition Center and the Southeast Mississippi Rural Health Initiative's Ryan White program. So, though I'm not new to the world of public health, organizations like these have given me a greater appreciation for the work that is done by this organization, the Mississippi Public Health Association. Their dedication to health policy implementation and advocacy for public health initiatives that work to improve the lives of Mississippians is something that has been important to me and has been central in my campaign for this position. So, if given the opportunity to serve as secretary, I would work to contribute to this mission and the effort of this organization through professional network expansion. So, this would include, but wouldn't be limited to, handling correspondences, maintaining schedules, and documenting all pertinent information. So, my ultimate goal and objective would be to strengthen communications between the organization, its members, and Mississippians as a whole. So I thank you all for your time and consideration, and I look forward to what the future holds. Thank you.
Thank you to the candidates for taking the time to share your platform with us today. We really appreciate the effort, the preparation, and your willingness to share your vision with us. Elections for the 2026 MPHA Board of Directors will be open December the 2nd through the 9th. A link will be provided to all active members. If there's any questions regarding the elections, please contact Lydia West. I want to thank the members of the nomination committee for the time and effort that they put forth to present a strong slate of candidates. It has been my pleasure to serve. I yield the floor back to President Bastring.
Thank you. Thank you to the nominations committee for organizing and working with these candidates. And thank you to the candidates for being so willing to serve. We very much appreciate your time. And then now I will turn it over to Sean Rossi, who's going to talk to us about the legislative session for 2026, the topics and the areas that we're going to support.
Hold on one second. I was trying to send y'all the file and it wouldn't let me send. There you go. I can't see. Do you see? Are you going to share the screen, Lydia, of the
I can.
actual report? Okay.
I
I
can.
tried to send it in the chat and I don't think it went through, but I'm going to try again just so people can have the actual copy. All right. There, I tried to have it open so I could share my screen and then it wouldn't let me share because it was open. So there you go. I have put it in the chat. And I also have in the chat a thank you to our committee members and I have them listed there. So if you want to look at the legislative agenda on that document, it should work. If you don't want to share the screen, Lydia, they should have a copy of it. But
It's not letting me share now.
Okay.
It says it's paused.
Okay, well, it is in the chat. So if you want to look at the
Sorry.
legislative agenda, you can download it yourself. And we have, I guess, divided this into 3 different areas. One, investing in a strong public health infrastructure, which of course is very important in these days. I think that most of us feel like it's something that it's not always seen as an investment, and we want to keep talking about that to our legislators. Advancing health across the life course, which includes a lot of our healthy aging work and mental health parity that we focused on, along with immunization policies. and modernizing public health systems. And a lot of that is focusing on some of the new, use of community health workers that other states are allowing, and also biomarkers and AI. So you can see this is not just a legislative agenda. It is a legislative and policy agenda, so it's pretty broad. We will have comments open. Did you say, Lydia, when were you going to close? December?
Through the 19th.
Through the 19th. I will say thank you to Lydia. Also, she set up many appointments with legislators, anyone that would meet with us. And she and I in November really went to the Capitol a few times and asked for input from anyone that would, any of the legislators that would meet with us. And I think 5 or 6 took us up on it and gave us some very good feedback. We also shared this with some of our advocacy partners like the Cancer Society and the Heart Association, things like people, to try to make our agendas match. So if they had something that they wanted to promote, we could include it in ours. From a committee standpoint, one of the things that we had decided is to focus on maternal health this session. There's a lot of interest in that. And for example, in the past, maybe we would have had just an MPHA day at the Capitol, and we're going to focus more on bringing together all of the partners that have something to do with maternal health and kind of giving legislators a one-stop shop to have booths up and learn more about all the different groups that are working on that topic, since it's a much interest at the Capitol right now. We do not have a date for that yet. We will, as a committee, meet next week, and we'll get that date to you as soon as we know. We're going to have to look at some of those dates that no one can do it and find out the best one. It will be sometime in February, I'm guessing. But any one of you that works in that space of maternal health that would like to join us, we would love to have you too. I think that the more that we can show that public health is part of the wider ecosystem of health in general, that it helps when we're talking to legislators. Do you have any questions for me or suggestions? Anything that anyone would like to add? I will put my email address in the chat too. And if you have one later, or if you read it, more carefully and you're like, well, what about this? This should be changed. I have this suggestion. Please send it to us and we'll be glad to look at it and bring it back to the committee. Thank you, Lydia.
And I just would like to add, it was in some of our meetings, we brought up that we would like to have a maternal and infant health, or at least a maternal health day at the Capitol. And there was so much interest and support of that. There have been several hearings. Jamisha has presented at some of those hearings, so they know that it's an issue. But it just felt like they were very welcoming and learning more about that. So Sean, thank you for developing that idea. And I think it will be, as you said, we've kind of had some MPHA public health days at the Capitol, but to have a one topic of interest, I think will just, we stand on 3 pillars of education, advocacy, and leadership, and that's just going to really advance our advocacy piece that's out there. Thank you. I'll be quiet now, Daniel, and pass it back to you.
Thank you, Lydia and Sean. The next thing that we will talk about is our membership and partnership update, and that's going to be given by Brittany Mosley, the chair of our membership and partnership committee.
Good afternoon, everyone. I hope everybody's doing great. Our update for our committee is that our main focus and our primary focus for 2026 is to really boost our membership, but really be able to sustain the membership that we currently have. This year has really taken a hit on public health, and we really want to love on our public health professionals and as well as people who just love public health. And so we are working on a survey, still working through a couple of kinks. We have the basis of the questions that we're going to utilize, but we wanted to engage a few other questions. The goal of the survey is to really just to see, number one, what benefits do the members really want to be able to, gain from it? Not just say that I'm a part of MPHA, but really saying, I want to benefit by It could be a job search, or with a lot of people that have lost their jobs, this year due to several changes. If there are a couple of RFPs that are out there and professionals can be able to obtain them. So we're really working on a few ideas. I know one that I have pitched and Lydia thought it was a great idea. We're trying to see how we can effectively make like a small little hub where there are a few opportunities that are available for people to apply for, just to say, hey, because I'm a member, their access to these opportunities. And so please be looking out in January 2026 for the survey. Like I said, we're still working through a couple of kinks of the survey, but we want it to be very concise, but very thorough, so that we really get an understanding of your voice and others. And so please, if you know other members of MPHA, please let them know that this survey will come out, and we will have a section on there for people to actually input what they really want to be able to see, and we will do our best to add that to it. And if there's any ideas of any partnerships that we could I know of one that we are working on, but if there are other partnerships that you all know that we should be a part of, please feel free to share. And if I don't see any of you all soon, I hope you all have a great holiday season with your family and friends. Please love on your loved ones.
Thank you, Brittany. Let's see. Is Katie Buys on yet? I don't see her.
I don't see her. She's in clinic this morning and was wrapping up with 2 patients. So we may have to, I have several things in my executive director report that relate to what she's doing, but if she joins later, we may just need to let her hop in
Okay.
after a while.
Okay. Lydia, do you want to go on to your executive director's report?
Sure. Thank you all so much. I am just so thrilled to be in this role. I'm somewhat new to it as of July the 1st, and just wanted to highlight several of the things that MPHA has been up to over this last year. To bring it to your attention, I wanted to say thank you to the whole board. We have several of our board members on the call today, so if y'all wouldn't mind waving as I call out your name. You've heard from Danielle Fastering this morning, so thank you, Madam President. And as the transition from Kay Bender to me took place, the president-elect position was held open, and the board decided not to fill that position, and Danielle has volunteered to stay in the president role for an additional year. So we thank you very much for your dedication and your hard work, Danielle. Karen Thurman, many of you know her. She is our past president. Unfortunately, she got called away with some professional responsibilities this morning, but she has been such an advocate. She's rolling off the board this year, as is Brad Martin, who was our secretary. Both of them have served a long time with MPHA. You've heard from Paige this morning, our treasurer, so thank you for your work. She started in February of this year, and it's been such a pleasure to work with her. Our APHA delegate is Sean Rossi. You've heard from her, and in that delegate role, she gets to lead the Policy and Advocacy Committee. So thank you for all of your work. Sean sat through lots of meetings at our annual APHA meeting, and she helps to be the Mississippi voice to the national organization, the American Public Health Association, and then she brings that information back to us. So she's put her email in the chat. So if you have things you want to make sure that APHA knows about, make sure that you speak with Sean about that. Several years ago, we started a concept of members at large. Because we are a membership-based organization, we have members at large throughout the state, and three of them are on this call. We have Allison Ford Wade. She's at the University of Mississippi. Robin Breland is on the call as well. She represents Central Mississippi, and she works for Special Olympics Mississippi chapter. Brittany Mosley, you've heard from as well. She is at Mississippi State University at the Meridian campus. And one of the members at large has to serve as the membership and partnership committee chair. So thank you, Brittany, for your work on that. And you've volunteered to do another year of that. So thank you for continuing to serve as that committee chair as well. Our third member that's rolling off this year, we're so sad, is Jude Haney. He is our member at large in South Mississippi and is at William Carey. Katie Buys is our Health and Racial Equity Committee Chair, and hopefully she'll be able to join. She works for the University of Alabama, but is based in Starkville, Mississippi. We've really done a lot to develop our student council, and we have our student member, Latasha Cox. Unfortunately, she broke her ankle and she's not able to join us today. So I'll give a little bit of her report later on. We do have a couple of paid staff. Valerie Collins is on the call today, and many of you know her. She's a longtime MPHA member and supporter. We do have an accountant with Jason Easley. He's been with us for a long time, and it's been a pleasure getting to work with him. And I just want to say thank you to Kay Bender. She was our executive director from 2020 all the way through 2025 and led us to many, many new heights. And it's just a pleasure to get to continue to work with her. And I just want to say thank you for continuing to mentor me in this role as I started on July the 1st as the executive director. So then I wanted to remind all of you that we have sections. Many of you know that. I see lots of section chairs or previous section chairs on this Zoom today. But just to remind you, we do have a epidemiology section, a health administration, a medical section, nursing, nutrition, office professionals, the public health education, policy and research section, and a social work section. And this year we have started a community health workers section, and this is in coordination with MISHWA. So it's not trying to take away from any of the great work that's happening in the state with our community health workers. It's just making a home within MPHA for our community health workers. So we're very glad to have this new section. In addition, we have chapters all over the state, and you'll probably hear throughout 2026 of some local meetings happening. We're looking at creating some chapters in different parts of Mississippi, and so you'll probably be invited to some listening sessions over the next year. MPHA has been busy, so I wanted to give a little highlight of the work that we've been doing over the past year. As I think most of you have been to our annual conferences and sat on these all calls as well, and you know that we've spent many years in our age-friendly work, and we're continuing that partnership with the Mississippi State Department of Health as well as AARP Mississippi to create age-friendly communities in Mississippi. And this is where people can age healthfully in place or wherever they choose to age, and moving more into dementia-friendly communities as well. With our maternal health work, we had a great partnership over the last 2 years with the Department of Health and the AIM work, and so really working at supporting maternal health in Mississippi and helping to train healthcare practitioners on maternal health in Mississippi. We received a grant through the American Public Health Association called the Strengthening Capacity to Advance Health Equity, and that was a project that Katie Buys worked a lot with in our Health and Racial Equity Committee. This was a survey that went out to our leadership, so our board, about the work that we're doing in health and racial equity through MPHA, and then we'll continue the work and survey to our membership as well. We started a health and racial equity real focus around 2019, 2020, and have continued to do that. And the committee, as well as the board, has decided to keep that on our website and keep that very forward facing. It is something that is a priority to MPHA. Through this strengthening capacity to advance health equity, we were also able to bring in some of our age-friendly work, and that moves us right into it also is part of our Special Olympics International work that we're doing. We were awarded a grant earlier this year to help pull together advocates throughout Mississippi to create a state plan for people who have intellectual and developmental disabilities, IDD. And so thanks to Robin and many other partners on this Zoom, we've been able to find people who work with individuals with IDD as well as individuals who have IDD. And we're pulling together to create a state plan where MPHA doesn't want to own the plan. We just are helping to gather the information and put it into action. So over the next year, you'll see some information about that as well as the report that we'll do with that. And then we have, as always, we were very active with National Public Health Week this year. This is something that the president-elect is in charge of. And so it was such a pleasure when I was in that role to get to coordinate those events. We had, MPHA had webinars every single day, as well as several in-person events. And then we were able to coordinate with organizations throughout the state to continue that National Public Health Week work. I wanted to brag on our journal. I just wanted to make sure that you knew that we have a professional journal. It's called the Journal for Public Health in the Deep South. And we have two different, I'll show you what the website looks like in just a minute, but we did have a special issue earlier this year on maternal mortality. And upcoming in the next month or so, you will see a violence prevention and public health edition. So for those of you that don't know about the journal, this is what our website looks like. And if you go up to the top in that blue banner, you'll see that there's a tab for the Journal of Public Health in the Deep South. And there's lots of information on that website. So if you click on that top one to visit the journal, it brings you to a page that looks like this. So you can see this is what our current, it's a virtual journal. It's not a print edition, but that does give us a lot more flexibility. So this is our current edition and what it looks like. And then over on the left-hand side of that website, you can end up dropping down to see all of the issues that we do. So if you haven't checked out our journal, I highly encourage you to do that. Several of you that are on this Zoom sit on the editorial board with that. So thank you for your service on the board. In this fall, we started a webinar series that was called the Healthy and Resilient Workforce Webinar. It is that information can be found on our website as well. This is another screenshot of our website, and at the top we have a section called News and Resources, and at the bottom of that drop-down menu there's an option for webinars. And so we've been continuing to offer those. You can see some of the ones that we offered early this fall, and we record those and put them on our YouTube channel, and I'll give you our handle for our YouTube channel later today. We have, and this is just thinking about how we can it was a variety of workforce topics, and just thinking about it's been a hard 5 or 6 years. And so just thinking how we can support our people and think about working with fatigue and burnout. We have at least 3 of those left. I hope that you will all join us tomorrow. Reverend Reginald Buckley, who is at Cade Chapel, is going to do a session at 11 o'clock tomorrow. The title of that is Strengthening the Soul for High Stress Service. And you can click that QR code or go to our website. You do have to register for all of these because they're at different times. So I do encourage you to do that. Katie helped us connect with Holly Seat. She's at Mississippi State University, and next Wednesday she's going to do one called Health Communication in Challenging Times. So I hope you'll join us for that. And then Sean Rossi, who you heard from earlier, she did one earlier in the session, but she's going to wrap up our series on the 17th with Supercharge Your Job Search with Artificial Intelligence. So please join us for that. We didn't apply for continuing education on any of these, but we give certificates of attendance. So if you can use those for your professional development, we want to try to support you in that way as well. One last piece with our 2025 projects, I just wanted to highlight our Student Advisory Committee. Latasha Cox, I mentioned, is our chair of that. And y'all, she is just rocking it. We have representatives from most of the schools of public health or that have a public health related program in Mississippi. And so we were trying to get student voices and making sure that MPHA, as a member organization, is working towards projects that students want. So they are looking at doing activities around campus on all of the campuses, and really focusing on National Public Health Week 2026, doing some voter registration drives, becoming health advocate or public health advocates and ambassadors on their campuses. And please continue to be on the lookout for that. This group is just full of energy. They tend to meet at 5 o'clock on Fridays, and y'all, they're full of energy and they don't stop. Our state is in good hands in the future with these students. Speaking of students, they're really helping us grow our social media as well. Sean Rossi has she's she is on the communications committee for MPHA and is helping us a lot with our LinkedIn. So if you are on LinkedIn, please pull out your phone right this minute and search for Mississippi Public Health Association. That's how we're found on LinkedIn, and on Facebook and Instagram. We are at the handle MPHASSOC. MPHASSOC. So please pull out your phones and find us there. We activated a YouTube channel during the pandemic, and it really is being underutilized. So over the last several months, we are starting to put more information there. The recording of this business meeting will also be there. So please look for us at the handle MPHA 1937. That's MPHA-1937. And it's 1937 because that's the year that we were formed. Thank you for that, Sean. She has put the link in the chat. Amazing. You've probably seen in the newsletters and e-blasts that have been sent out, but we are doing our call for awards. We do longevity awards every year, and the call for our longevities is open through the 15th of this month. So please, if you've worked in public health for 20, 25, 30, 35 or more than 40 or more years, we want to give you special recognition. So please email me that information. Just tell me that you've worked in public health for one of those. Please help us spread this around your businesses as well. We've put it in e-blast, but we just want to make sure that we are lifting up all of our members who have worked in public health for a long time. So then we have a strategic plan. You probably remember us presenting this. It ran from 2023 to 2025. And again, we asked for lots of member input on that. And it focused on 3 different pieces. We have strengthening public health practice, where we were looking at really increasing our educational opportunities. We wanted to work towards building a public health movement and thinking about our advocacy efforts in that respect, and aligning our organizational infrastructure and capacity. And so thinking about our partnerships and where we were going in our funding and organizational directions. We've worked hard on these, and we'll put some more information on our website soon about the accomplishments, because we did meet many of the objectives that the strategic plan put out. But we need to start on a new one. So starting in the early 2026, you will be seeing lots of information and asking for your input, because we want to make sure that where MPHA is moving is where our members want us to move forward. So we'll be having some listening sessions and some deep thinking around this over the next several months. All right, so as Susan helped us think, elections are open. So just in case you didn't see that link in the chat, I wanted to give you a couple different ways that you could vote. You do have to be a member to vote. So if you haven't renewed your membership, please consider doing that. The first question on the election or on the ballot is asking for your name. Your name will not be associated with your vote at all. It's it's set up so that I can disassociate both of them, and then it can be double checked. It's just to verify that only our members are voting. So if you're ready to vote, there's 2 different ways. One is that you can go to our website under the About Us section. There's now a option for the 2025 elections. It brings you to a page that looks like this. You can see kind of in the middle of that page, you can learn more about each candidate. Those are the links that I posted in the chat earlier. So there's one folder for the president-elect candidates and another folder for the secretary. And then when you're ready to vote, you can click on that link right there. Or we can use technology, and I've put up 2 QR codes. So if you want to pull out your phone again, you can scan the blue QR code to learn more about all the candidates. And then the green QR code will take you to the survey, which we're using Qualtrics as a ballot for this. So I'll leave that up for just a few more seconds in case people are scanning. And that will be open through the 9th of December. I wanted to again remind you, if you haven't renewed your membership, please consider doing so. We have a lot of great things that are going on and continue to work on. As Sean talked about, we're going to roll out our legislative work just in less than a month now, and we're just going to continue to roll from there. You can rejoin in several different ways. This is a screenshot of our website, and it is in underneath that. I got to this page by going at the very top. There's a membership and support option. So you may be an individual member, or some of our members are through an organizational. It is Giving Tuesday, so I did want to remind you that if you are so inclined, we are a 501c3, and you can donate to us. You can scan that QR code to the donation page, or there's a link right there. We have lots of things going on in 2026. As I mentioned, our strategic plan will start to be developed, and we look forward to your input on that. National Public Health Week is always the first week of April, and that is going to be April 6th through the 12th. We already have a lot of great ideas and things coming together for that, so I'm very excited for it. We'll host a leadership symposium, an annual conference in the coming year, and our communications committee is really doing some great work, and we're looking at doing some communication skill building for our members as well. Any questions? I'm going to stop the share. That was a lot of talking I just did. I do see that Katie has rejoined. I'm not sure if you can unmute. I covered some of the information, Katie, but I will pass it back to you, Danielle, to.
Thank you, Lydia. That was such a comprehensive report, and I really think it showcases all of the wonderful things that MPHA is doing. We are very, very busy. And so thank you for wrapping all that together for us. Let's see, Katie, are you able to share your report for health and racial equity?
Yes.
Okay, great.
I'm late joining. So we've had a busy year, a lot of discussion with the Health and Racial Equity Committee, as there have been a lot of things at the federal and state level that have challenged some use of, or whether we can use some of the terms like things that public health is all about, like equity. And it's been a major goal that we can continue to support our members, and that we can also continue to receive funding through our regular funding sources. And as we have navigated and talked with members and talked with employers of our members, we have not made any changes to any of our language, and we continue, regardless, we're going to remain committed to focus on health equity, and that's in alignment with what we do in public health anyway, and certainly with our Health and Racial Equity Committee. It's also in alignment with the state health officer's plan, and how he's highlighted an emphasis on morbidity, maternal morbidity and mortality in our state as a main objective for this year. So we were able to present at the American Public Health Association meeting a poster on the work that our Health and Racial Equity Committee has done. One of the main things we've done this year was a survey of leadership on how we're doing towards was actually specifically a DEI survey that we had funding at the end of last year to do. So we did proceed with that survey and got some good feedback on focus areas, things that we're doing well, and then kind of focus areas for the future. One of those is to include an emphasis on intellectual disabilities, and supporting those people within Mississippians with intellectual disabilities. And I believe Lydia has probably already presented on the Special Olympics grant that we received. Have you heard? And yeah, so several of our committee are also on that grant and working with people around the state over the next several months to support those organizations and individuals who support or work with or who have intellectual disabilities. And then another area of emphasis that some suggested on the survey was that we continue to try to partner or find ways to partner with Native American communities within our state. And if anyone here does have suggestions on that, as we try to find ways to build better relationships and connections and to support specifically the Choctaw people, we would certainly welcome any feedback or connections that you might have. And oh, I had my notes and now I'm not looking at them. Oh, and then one other thing that we're working with the membership committee is we're working on a survey that they were already going to be doing of all of our members, and our HRE committee is also going to add to that survey and try to find ways to support our specifically MPHA members who are from traditionally or historically underserved backgrounds, as far as the types of sessions, educational sessions that we offer on Wednesdays and other things like that. So just trying to find ways to support diverse members as we kind of move forward in navigating some of the challenges that have come on this year. So happy to talk with anyone. If you want to message me, I'll share my contact info, and we are open to new members. We have a smaller number than we are able to have. So if anyone knows of people who would be a good fit for the committee, we are certainly open to that.
Thank you, Katie. Let's see. I think that is everything that was on our agenda. Lydia, did you have anything else that you wanted to talk about before we move on to the next piece?
We had a speaker scheduled to come and talk with us a little bit about advancing our career in public health. Unfortunately, that person is ill today, but I did want to share our website with y'all, because we do have lots of resources that we've updated over the last little bit to help with updating your resume and other professional development sorts of things. So this is the main page of our website, which is mspha.org. And under news and resources, we have updated the professional development option information that's there. So if you click on it, we have lots of information about free continuing education opportunities that are offered through many different public health organizations. And then we also, under news and resources and career services, we have lots of tips about looking for jobs online related to public health, and then several job boards, as well as a career center that's there. And we'd love to, as Brittany was saying, we're looking at creating some member-only parts of our website, but if y'all, this is a very dynamic website, meaning it changes all the time. So if you have ideas of things that we could share through our website or our social media or in our newsletters, then we are all ears and would love to make sure that we share that information as well. Thank you, Danielle.
So as we close out today, I just want to thank everyone for coming to the business meeting. If you have any questions, please don't hesitate to reach out to either myself or to Lydia, and we'll be happy to answer any questions that you might have. Please take advantage of some of those resources that are on the website if you find that you need them. I know that many of our members are experiencing joblessness right now. There's been quite a few layoffs and things like that, and it's very difficult going into the holidays. So please use those resources, or if you can think of other resources that we can link you to, we're happy to do that as well. Thank you for the board. We're a really strong team, and I just appreciate everyone's help with making the organization the very best that it can be. So thank you for that. And as you go into the holiday season, I hope everyone is healthy and happy, and you can spend time with family and maybe put wellness first. So thank you all. And I look forward to seeing the next time we can all be together.